But don't you think they're unknowingly cutting corners? Because I think people are good for the most part. And the dentists I meet are doing the best that they know how. But do you think that they're cutting corners because they think that all that other stuff isn't necessary?
Randy, what if you paid you found a dentist that was $2,000 cheaper, and you went through this and your teeth broke or fell out when you were out with your friends? What would you do?
Yeah, you wouldn't be happy.
You wouldn't be happy, right? No matter how little you paid or how much you paid. At the end of the day, you want to pick a doctor, you want to pick an office that will be there for you, that will show you cases that they've done for 10, 15 years. This is not, unfortunately, this is not a procedure that should be done by someone who just started. You know, it's not like you come out of dental school and you do a filling or you do a single crown. This is high-level dentistry. This is oral surgery, prosthodontics, smile design, lab technician. This takes every single aspect of dentistry that you need to be an expert at, and I don't say this lightly, you need to be an expert at to be able to get these cases done efficiently. Yeah, anybody could do it. You want to go to the dentist 2, 3, 4 years to get your case done? You can go anywhere, absolutely. But you want to get this done quickly, as fast as one day, right? Why wouldn't you go to somebody who's the best? Because one thing in life you can't buy, and that's time.
You know, we talked about this a little earlier about, I said, like a chip on your shoulder. About, you know, Oprah Winfrey said, what makes for a good guest? They asked Oprah, what makes for a good guest? And they said, well, they explain what they do very well. Number two, they have a lot of experience, and they're humorous, which you're kind of funny. But they all have a chip on their shoulder. Almost like, why does they live with like a sense of urgency, of frustration. Why does everybody get this? I picked that up from you a little bit.
Yeah, it's, you know what, it's because, you know, I'll never forget, when I was in dental school, they asked me to write down my mission statement. They said, what is your mission statement to be a dentist? And the gist of it was, I want to change the brand of dentistry. And the brand of dentistry right now is that people don't like the dentist. And by doctors doing cases that they should not be doing, they're enabling the bad rep that dentistry has. So it's frustrating for me, because at the end of the day, the patient is the one that's getting hurt. It's the patient's life that's being disrupted. When the case doesn't go right, the dentist goes home at night, right? But the patient has to suffer. Why? The patient comes to the dentist, they don't know better. They say, okay, well, it's a little bit cheaper. This guy has a certificate on his wall. I'll do it.
So what do you do then? I mean, you mandate like a guy's got to place 500 implants before he gets to work on paid patients?
I mean, you should look at his certifications. You should see if he's board certified. You should see how many cases he's done. Like, I want to see, how many do you do? Is this all that you do? This is a specialty type of practice. To do full arch of dentistry, full mouth implant dentistry is a specialty. You can't dabble in it. You can't do a filling one day and a full arch of implants the other day. It doesn't work like that.
Is this fair to say that, look, if you find a dentist that has an intraoral scanner, they have a digital printer that's actually printing the teeth, and a mill that makes the final part of the teeth,